Sponsored by Memphis. That crafty chick. Express Car Service.
Welcome to Grown Man Talking. Do not adjust your TV. Yes, I got on pink pants. We are celebrating and acknowledging breast cancer awareness this month in October. And welcome to Grown Man Talking, and I am Devin Banks. So this topic is very sensitive, but also very important. And I want to make sure I dive into this and hopefully educate some people, as well as introduce you to some new people that you may not know. So I have two beautiful ladies here who have two separate stories that they're going to share, and they're both important in my opinion. First, I want to introduce a good friend of mine. I met her actually doing community service. Unfortunately, she's an Eagles fan, but I mean,
go Birds.
I mean, we gonna pray for her. But we met actually feeding the homeless, doing different things around in the community, fundraisers, and she's a good friend of mine, and her name is Chandlin Richardson.
Thank you so much for having me. I'm looking forward to being here today.
Okay, you look good in the pink. I like
Thank
it. So I want to give a breakdown about Chandlin, and that those of you who do not know her, she's pretty well known in the medical area and in the community service area. She's worked with a lot of people, a lot of joint ventures, a lot of joint friendships. But Chandlin is actually a native of Pasadena, California. She moved to Memphis when she was in high school. And what high school was that?
East High.
Again, a strike two, but we're going to keep going. She has 2 adult kids and a 3-year-old grandson. What's that grandson name?
I call him Jelly Bean.
What's his government name?
His name is Darren.
Okay. She has a Bachelor of Arts in Sociology at the University of Memphis. She's a committee member for Memphis Urban League, which is a relatively new position. Mm-hmm. She's a healthcare advocate and wellness professional and community leader. Over a decade of experience in the medical case management, healthcare, and healthcare advocacy. Welcome, Chandlin.
Thank you so much.
So before I dive into you, I want to make sure I introduce this other beautiful young lady who's also wearing pink, who's also a good friend of mine. I actually met her through some mutual friends, mainly my business partner, D-Lax Jones. And we eventually had other mutual friends. So we just kind of connected. And her name is Sasha Rogers.
That's right.
Welcome to the show, Sasha.
Glad to be here.
Thank you. Your bio is very long. So this is going to be a 3-part series. But Sasha is a 2-time breast cancer survivor. Touch your neighbor and say 2-time.
2-time.
All right. She's a volunteer for the Baptist Cancer Center, for the West Clinic, and the pink is at Savvy. Mm-hmm. Also a former panelist with the Memphis Breast Cancer Consortium. She's a member of Fresh Start Anointed Ministries. Is that here in Memphis?
Yes.
Okay. Also a member of Alpha Kappa Alpha Sorority. Throw it up. Okay. She has a Bachelor in Business from Christian Brothers University. Shout out to Christian Brothers. Master's in Administration from Central Michigan University. And she's pursuing her doctorate in organizational leadership at Liberty University. That's currently right now.
Currently.
Okay. She's a proud mom of 2 children and a toy poodle and an avid Grizzly friend. So welcome, Sasha and Shannon.
Thank you.
Thank you.
So I think I want to start this off with first, before we go deep, I want to talk about the advocacy part of it. So I'm going to start with you, Chandler. You have a very interesting story. You went to the doctor. Well, I'm going to let you tell it.
Okay.
You're the guest. So share your story about you actually going to the doctor. I don't know if it was just a regular checkup.
Yeah.
Or just to get checked, or you had a drunk wild night and you just want to go to the doctor. I don't know why you went, but share your story of you visiting the doctor and kind of go from there.
So I'll back up a little bit. from the age of 15, I was always that girl that did self-breast exams. They were important. So I was doing a breast exam, felt a lump. It's like this lump feels a little weird. It was just really rigid and hard in my breast. Kept checking it over a period of 4 months. And I said to my husband, I said, "Well, put your hand on my breast and tell me what you feel." And as soon as I did it, the color left his face. He said, "Is that a lump?" I said, "Yes." He said, "How long have you been feeling that?" I said, "For about 4 months." He said, "When are you going to the doctor?" I said, "When we get back from Las Vegas." I said, "I'm not about to ruin our trip." I said, "We're going to have a good damn time."
So Vegas did come first.
Yes,
Okay,
we
just
went to
making
Vegas
sure. All
first.
right, go ahead.
So we went on our trip to Vegas, and then as soon as we got back from Vegas, I immediately went to the doctor. Now at the time I was 29 years old, so we're talking about very young. At the time, no family history of breast cancer. So I went to my doctor. At the time, my doctor was a male, and I told my doctor like, "Hey, I've been feeling this lump in my breast." I check my breasts different times of the month. I've been doing self breast exams. I know what my normal feels like. This just doesn't feel right. Without even touching or examining me, he said, "You're 29. That can't possibly be what you're feeling."
What does that mean? What is your? I don't. Break that down for me.
I'm assuming, and we're just going to go in an assumption, that he felt like you can't be feeling anything abnormal because you're only 29 years old. You don't have a family history of breast cancer. You're making an assumption about what this lump is. You're fine. But he didn't examine me to be sure, to say, "Well, you know what, that doesn't feel right," or, you know, he just didn't make an assumption. He just didn't examine me. He didn't take my concerns seriously.
Let me share a statistic while you're on this subject. Younger people have a better survival rate, but under the age of 40, there's a 95% survival rate. The ages between 40 and 59, there's a 91% survival rate. So I wanted to point that out while you were talking about age. But go ahead, you can continue.
So like I said, he told me, he said, you're 29, no family history of breast cancer. That can't possibly be what you're feeling. I immediately said, "Get me a female provider." I didn't leave the office. I told him while I was in the office, I said, "Get me a female provider." And this doctor was an MD, male MD. He thought he was being funny and said, "Okay, let me get you a nurse practitioner." Well, we got to understand, first of all, nurses, I believe, in my opinion, are angels on earth. But the nurses are trained in general to be more hands-on. They touch people. Or MDs, I'm not mitigating what MDs or medical doctors do, but they're a little more clinical in research, where nurses have to be hands-on. They're the ones that are actually going in the room, doing vitals, touching patients, drawing blood. So they're a little more hands-on. They touch their patients. They have to flip them over. So they're a little more hands-on with their patients. So the female nurse practitioner came in, and I learned after the fact that the doctor didn't tell her which breast is to check. So she came in, she did an examination. She checked the left breast, she checked the right breast. She went back to the left breast. She kept going exactly in the area that I had the concern. She said, "You know what? I don't like how this feels. Let's go and send you for a diagnostic mammogram." And sure enough, I went to Methodist, had a mammogram, and it turned out to just be calcification in my breast. But
What? Say that again.
calcification. So it's just like calcium buildup, calcium deposits in my breast. They can feel hard, they can feel rigid, which is why I was feeling that rigidness in my breast. And because of that, and because I was so young, they did not like the fact that I had developed calcification so young in my breast. I had to get mammograms every other year until I was 40.
Interesting. So I mean, you laid a lot on me right there. That's a lot. I'm trying to digest it because I don't get a warm and fuzzy feeling about the approach of that doctor and your experience. But I also would like to ask, do women think there's a difference between male and female doctors that's trying to help you in cases like this when you're trying to get diagnosed?
So I'm going to give my personal opinion. Working in healthcare, I'm a medical case manager. I actually work at a practice with two female nurse practitioners that started their own practice. We came from a large hospital organization, and they started their own primary care. I personally avoid male doctors. I'm a female. I need to go to someone that has the same experience as I do. That's just me personally. I'm not going to deter anyone from seeing a male provider. Okay. But for things that I experience as a female, I would prefer to go to someone that has the same experiences. I'm not going to go to a male GYN because you don't have the same anatomy that I do. Mm-hmm. I'm not going to go to a male primary care provider. You don't have the same anatomy that I do. Like, if we're going to have a discussion about some of my concerns, I need you to at least at base level understand the things that I am experiencing just on a human level. So for me personally, I prefer a female provider.
Okay.
I just think that it's difficult for you to truly understand if I'm saying I have cramps and they feel like on a scale from 1 to 10, they're a 7. What does 7 feel like to you? And you don't have cramps? And how long would you allow me to continue to have that before you make an intervention? Will you go by the guidelines that the American Gynecological Association sets, or would you, as a person that has had cramps in the past, say, okay, honey, we ain't gonna wait 6 months. We're gonna let this go 2 months with some intervention. If it doesn't work, then we're gonna go to the next step. Okay. So I just think that that's important for you to, one, develop a relationship with the provider that you trust, and then two, listen to your body and pay attention and not wait too long to communicate with your provider.
Okay. I can respect that, but I also want to be very clear. I don't want to give the impression that male doctors are insufficient. Or
Absolutely
they don't. No,
not.
this is me. Just
Yes.
I don't want to give the impression or this platform to say they don't have the ability or the education to understand a female anatomy. But I also
There's
respect.
too many that have made too many strides in the medical field that have saved lives.
But I also
we
respect.
can say what we can about Ben Carson, but I mean, he was a brilliant neurosurgeon that separated conjoined twins.
Right.
So I am not going to denigrate the advancement of male providers.
Right.
My situation was my circumstance.
Absolutely.
And for me personally, I had to do what was comfortable for me. And I think it's important. And the reason that I am speaking to that and advocacy in general, the problem that we have in the medical field, period, is that people do not go to their provider and speak about what is important to them, or even communicate to their providers, because they don't feel comfortable. If feeling comfortable is having a provider that looks like you, whether it's a person of the same color or the same gender or in the same community that you live in, you need to do what makes you feel comfortable to advocate for your health care, because at the end of the day, you're promoting what's comfortable and going to make sure that you have a long and healthy life.
Yeah, and that's why I respect your decision to choose another doctor or get a second opinion. I think that's important. I think everybody should do that. Mm-hmm. I don't think you should ever just go to the doctor once, and just accept it. Because that's why they call it practicing medicine. It's not called medicine is resolved.
Absolutely.
It's a practice. That's the same way I say about pest control. They never say pest eliminating. They're gone forever. They're controlling it. Just like medicine, they're practicing it. So you should always understand that you're in a field that is a ever learning, revolving environment.
and let me make sure I say this before we move forward. My mother is dealing with some serious health challenges right now, and her first cardiothoracic surgeon was a female, and we were not getting the results that she needed, and she's now seeing a male cardiothoracic surgeon, and he's brilliant. So at the end of the day, we needed to find her a provider that was going to give her the optimal care that she needed, because her surgery is extremely complicated. Originally, they suggested she go to Houston to have the surgery. That's how complicated it is. There's only a few providers in the country that'll even do her surgery. So it's not necessarily about the gender per se.
Yeah.
It's about finding a provider that you feel like you can receive the optimal care from. And I had to advocate for a provider that made me feel comfortable. And in my situation, it was a provider that was female.
Yeah.
And I do agree with that. I have a combination of both.
Okay.
And I'll talk a little bit about that later, but I do agree with that. My oncologist is a male doctor, and he's amazing. But I do have a combination.
Yeah, I'm looking for a female doctor now because I just like to be touched. No, I'm just kidding. Just kidding. I'm kidding. But no, this is good information. I appreciate you sharing it because that's a side people don't talk about, and a lot of people don't. They'll accept whatever the doctor tells them. They'll accept it. They'll go home with it. And it could be wrong. It happens all the time. And I should have did research on it. This is a learning curve for me. I should have found out how many misdiagnosed people, it is in the city or the United States, or that have been misled by information. Because that would have been good to know.
To probably assess that. Because
there's statistics for everything. That's probably going to be a ever-changing number, but there's statistics for everything.
Yeah, because, there's, and I'm sure you could speak to this too, there's so many things that you have to factor in with breast cancer. There's density of your breast and how you can even, detect any cancer. I have a client that had breast cancer, no history of breast cancer in her family. She was getting mammograms regularly, was due for a mammogram in November of 22. She went and had a mammogram. It was normal. Went in December of 23. Now, we're literally just talking about 13 months. She was 1 month off, just 1 month. Went and had her mammogram. She had breast cancer, and it was aggressive too. And so thankfully she's in remission. And I in preparation of coming on the show, I called her and I said, hey, now that you're a little more removed from that, have you had an opportunity to reach out to additional family members since you've had treatment and now in remission? Have you found out if there's any other family members in your family that have had breast cancer, or did you and your provider go back and look at your previous mammogram and see if there was something that they missed, and maybe, the one that you had in December of 23, that maybe that was cancer there that they missed in 22? And she said, no, they looked at the mammogram extensively and they didn't miss anything. It just developed from 1 year to the next. So.
Speaking of aggressive, I want to talk to you, Sasha, about the different stages. So you can kind of educate me a little bit. There's 4 different stages, right, of cancer. So the survival rate, from what I understand, for the different stages, like stage 1, there's a 99% survival rate. Stage 2, there's between 90 and 98% survival rate. Stage 3, there's a 66% between 98% survival rate. And then stage 4, that's 29% survival rate. So aggressive would be the stage 4, right? Okay. I want to make sure I'm understanding. So aggressive is not 3. Aggressive is 4. Give us a little bit testimony about your journey. You can start with the very first time you even were told in a conversation in the doctor's office about whatever you're comfortable with, about, hey, we might see this, or come back, I'm waiting on, these results don't look good to me, yada, yada, yada. You can start from there to now and talk about that journey if you want to, as much as you would like.
So I will start with, and I'm glad you are talking about the stages because I have some information that's going to probably be new to you regarding that. But I was diagnosed with breast cancer at the age of 32, stage 0. I had not made it to stage 1. So I got it very, very early on. My story is at home. My husband was at work. He worked overnight. And I would take a shower, throw my robe on, make some tea, get in the bed and read a book. And that's what I was doing the night that I discovered that something was off. So I took the shower. I didn't have on a bra or anything. I had my robe on. I was sipping tea, literally sipping tea. Set my tea on the nightstand, and my robe moved, and I saw something wet on my breast nipple. Like, wait a minute, why is this wet? And I looked down at it, and it was kind of brown. It was like a brown discharge coming from my right breast nipple. So I kind of like touched it, and it came out a little bit. So, and this was in 2013. So I took a picture of it with my camera phone. I sent a text to my husband. I sent a text to my mother, and my mom. She was so funny. She received the text and she was like, "Who got shot?" Because it was like this little round. Nobody got shot. I especially didn't get shot. But my husband called me and he was like, what's that? What's going on? And I said, I don't know what it is. So I was very anxious. I really couldn't sleep. I couldn't wait until the morning so that I can call my primary care physician. And that's what I did. I called my doctor, and they had me to come in right away. And so when I got there, they did a self-exam on me, and more of the fluid came out. And from there, immediately, same day, going from one facility to the next, getting testing, I went immediately to have a ultrasound in which they kept going into a certain area. So me, I worked for a radiologist for about 5 years, so I knew that they kept going into this area. They kept looking at this area, so I knew that I'm going to get some news that I'm not going to like. And I was by myself at the time at the doctor's office. So just a little bit of a fast forward, I was told that I had breast cancer, ductal carcinoma in situ. So breast cancer of the milk duct.
Repeat that.
Ductal carcinoma in situ.
Okay.
So breast cancer of the milk duct. It was stage 0. It had not made it to stage 1 yet. So in that case, it didn't require me. And this is, you want to think about the advancements of breast cancer treatments and knowledge back in 2012. What they know now is totally different from what they knew back in 2012. So
I'm assuming, I don't mean to cut you off. I'm assuming, because I don't want to sound ignorant, is that what you just described, kind of like around the areola area, or
yeah, areola, nipples,
okay.
breast cancer of the.
So is this similar to like I don't want to say blood clot, but I don't know. Is there like a blockage or something?
So it can be kind of described as like the milk ducts being blocked.
Okay.
Right. It can be described as that, in which now I'm learning there is another new breast cancer that they're saying that they've discovered in the milk duct, which makes me want to go back to the doctor and say, can you go back and look at my results from even then? Because remember, the cancer came back to me 8 years later. But I had a double mastectomy. I opted for the double mastectomy. I did a gene test. I did not have any abnormal mutations, which means I didn't have any history of breast cancer traits in my family. Although my grandmother had just passed a year before from breast cancer. Well, she had breast cancer and went into remission, and then it came back, spread to her brain. But even with that, I did not have any genes that would say that I would have breast cancer. And so fast forward, I was diagnosed with breast cancer again. Like, what? I don't even have real breasts.
And what year was this?
This was in 2021.
So about 8 years later.
Mm-hmm.
Okay.
Diagnosed with breast cancer again. I had a lump this time, and it was almost stage 2. So I had a lump, like kind of near my scar tissue. So I have breast implants. So I had double mastectomy, reconstructive surgery. They did an amazing job. I literally could just go without a bride.
Amen.
So when I felt the little lump or whatever that was, I said, well, maybe it's time for me to get new breast implants. Ooh, I'm getting ready to get some new ones. I think I want, like, what size do I want? Went to my plastic surgeon, and he asked me, what is that? He felt it, and he said, well, I don't want to go further with this, with the implants, because we need to see what this is. Mm-hmm. Went back to my primary care physician, went to breast surgeon, and they had to do a needle aspiration, because at this point they couldn't do because I didn't have actual breast tissues or anything, because I have breast implants, so they had to do a needle aspiration, and it came back breast cancer, and actually more aggressive than the first breast cancer diagnosis. So the second diagnosis was HER2 positive. So I actually had 2 different kinds of breast cancer.
What?
I had 2 different kinds. And the HER2 positive was very aggressive, in which I had to go into aggressive treatments. So extreme chemo, radiation, and even now I'm currently still taking medication. So
I'm going to let you take a break here while I kind of assess your strength. And the reason I say that, and I'm not just talking about cancer right now, I'm just talking about you losing people. And I won't go into all that. I'll let you do that if you want to, but you've lost a series of people that's close to you. The time span is not long. Mm-hmm. I don't even think you've had an opportunity to grieve from one situation to another. Not to mention having time to be emotionally attached to what you're dealing with. So I think that type of strength is extraordinary. Thank you. I want to take a minute while you kind of digest what you're saying, because you're listening to yourself as you talk. So, I don't want to overwhelm you even by what you're hearing. Even though it's not new to you, you're hearing yourself. And a lot of times we don't hear ourselves. We don't hear our own stories unless we're telling it to somebody else. Mm-hmm. It's kind of like a resume. You fill out this resume, you be like, wow, I did that. I was vice president, whatever. But my point is, she's hearing herself. Mm-hmm. And you can kind of see the emotion starting to muster up. And I want to kind of give you a break while I acknowledge your strength. While we all listen to you and as you listen to yourself. Because I admire that. And the reason I admire that is because you're probably one of the happiest people I see on Facebook. You're one of the happiest people. I've never really seen you sad on Facebook or in real life. I remember asking you to guest host for me once when I was hosting at District 12. And you smiling, happy, a million friends. Like, you would have never thought.
Had a flight at like 5 a.m.
Yeah, and you still came.
I
mean, your sacrifice, even now, you're going through something now that I don't feel like I'm in a position to discuss. I'll leave that all up to you. But you're going through something now as recent in the last 48 hours. They could have easily called you not to be here. And you could have easily turned down that guest host position because you had a flight. But the sacrifice that you make constantly for other people kind of magnifies or defines who you are as a person and your character and the strength that you have. And I know you go to the gym, but you don't go gym to lift weights, but you definitely probably the strongest person in that gym spiritually.
Thank you.
So I want to make sure I give you your flowers.
Thank you very much. I like to say that I thank God that He chose me to be a face for a lot of the things that I've experienced, because it gives other people hope. It allows other people to be able to see what it can look like to come out on the other side, to fight and to not give up. Because oftentimes when people are given news that is not, pleasing, people give up sometimes, or they don't feel like that they can get through it. So the first battle of breast cancer, I was my dad's only child. He was diagnosed with liver cancer. I was going through the process of getting my chest expanded for the breast implants when I lost my dad. But I still pushed through because I had other loved ones, my children, to live and fight for. The second time I was diagnosed with breast cancer, I planned a family trip with my family to celebrate my mother's birthday. After our family trip, my brother was carjacked, robbed, and killed. Everybody was preparing to fight with me with my breast cancer journey, and I lost my brother, but I continued to fight on. And then I lost my fiance as I was on the end of my breast cancer journey to stomach cancer, having stomach aches, stomach pains, and then eventually learning that he had stage 4 stomach cancer and passed away. And then my mother passed a couple months after him from lung cancer. And now I'm dealing with my sister was having headaches and then decided I can't take these headaches anymore. Let me go and check this out. Let me just go to the emergency room because I can't take it anymore. And then immediately have to have brain surgery and then be pronounced brain dead and deceased the next day. So.
But tell them how recent, what you just said, how recent it is.
So with my sister, all of that occurred on Thursday and Friday. And so she's still on life support because of her organs that's going to be donated. We talked to the donor transplant team to, start making arrangements for that. And that's kind of why she's still, and then allowing time for other family members to come in from out of town to see her and spend time with her. But dealing with that now, actually going to leave here and go spend time with my family in prayer before tomorrow, which is going to be a pretty heavy day for us as we allow her to be able to be at peace.
So I just want to say, and if I could hold your hand while I say this is what you call a friend.
Yeah.
Because she showed up. Where's my camera? She showed up. Sasha Rogers showed up when she really basically can't show up for herself.
Yeah.
This is what you call a friend. She texts me, I will say 24 hours after she found out this information, and said, Devin, I'm committed to coming on your show. Because her story, she knows is bigger than her. And I'm going to talk about that at the end of this podcast. There's a session where I call "Don't Make Me Preach," and I'll kind of go into that. But I have to acknowledge, and the reason I wanted to touch your hands because sometimes spirits transfer, and I need some of that strength because I haven't met anybody that strong that can deal with that much emotional weight. That's heavy. That's heavy. And you came in smiling, ready, and dressed amazing, swag on point. Nothing is wavered based on what your experiences are. I can't do nothing but respect that. And
The Bible says, count it all joy. There's joy in everything, even when it does not seem like it. And even in this moment, want others to know that you have to see about yourself. Anytime your body is ailing, aching, or doing something that is normally not doing, or you're feeling something that you have not felt before, you can't self-diagnose it. We are not doctors. Even doctors have to go and be seen by other doctors. You have to go and see about yourself because sometimes when our body is telling us that something is not, it's not right. That is our body. That is God's natural way of telling us that something is not the way it should be. And because He has blessed people like you and other healthcare professionals to be able to do the research and to be able to get all of this training to be able to help us, we have to advocate for ourselves, starting with what we feel in our bodies at home. Before we even get to the doctor, you have to be able to say, this ain't right. Let me go check this out.
I don't know if you all been paying attention. I don't know. I know y'all from my Facebook friends. I assume you watch. But for the past month in October, I have been honoring different people that some I know, some I do not know, about how long they've been survivors of breast cancer. And the reason I wanted to do that is because I don't think, this is just my assessment, I don't think men are involved enough in the breast cancer awareness aspect of it. I think there's a lot of men who volunteer, a lot of men who wear pink, but I want to make sure it's not a fad and that they actually, are involved and understand that these people are actually really struggling and, on the verge.
And not only that, it could be a man that
it could be a man. Exactly.
I've met several.
It could be a man, and that was another point I was going to make.
I wanted to speak to that. I'm so grateful to be a part of an amazing church. Our church today had a segment. I attend Monumental Baptist Church, and our pastor is Mike Collins Jr., but we had a segment where we talked about, because it's Men's Month at our church, where we had a segment where we talked about men and male breast cancer and talked about the incidents and the symptoms and things that the males need to look for, because men tend to not go to the doctor until y'all are about falling apart. Yeah, you're right. And so just making sure you're at least aware of the symptoms, because sometimes we associate breast cancer with it being a gender-specific illness. And so if men are at least aware or know that if they have a family member that has breast or cervical cancer, that increases their chances, or testicular cancer, that increases their chances of possibly having male breast cancer. So they just need to know that those are potential things that they need to look for in their family.
Yeah, and that's the point I'm making. Like, the conversations you hear from men are about prostate cancer, not breast cancer. So that's kind of the point. That's why I am more or less trying to push that from a male perspective, because next year I actually want to do a show
And we talked about that.
Actually,
We
I
tried
actually-
really hard
yeah.
to get you that band.
Yeah, actually, I want to do a show on male breast cancer because I think that is it's a huge imbalance socially, even with the conversation. It's kind of separated. It's like prostate cancer, then breast cancer with women. It's just like a mental thing, and it's the way it's marketed and the way it's discussed, and that's why I am pushing so hard on my social media page about having a voice about recognizing these women. And I don't know a lot of these women I don't know personally. They give me this information. So I take that information and I share it back in honor of them, recognizing them. And I'm proud to do so. So there's 2 questions I want to ask each of you. It's the same 2 questions. And then I'll go into my closing. Let church say amen.
Amen.
But these 2 questions I think are triggering, and it helps you think. And I'm going to start with you, Chandlin, because you're a very snappy thinker. I'm going to go with you second because you're in human resources and you're very logical and you're by the book. So my first question is, what is your biggest fear?
I've experienced it almost every year since I turned 40. So 40 is typically the year that, you start having mammograms. And every year since I've been 40, my mammograms have been abnormal. And I've had to get additional testing. I've had to get biopsies. Thankfully, the biopsies have not shown breast cancer, but I'm right now getting mammograms every 6 months because they're still not liking what they're seeing. So right now I'm still dealing with this. I just had a mammogram last month. My I don't know if I would even call it a fear because thankfully I'm a believer.
Good answer.
It would just be preparation and then a plan of attack. I have an amazing provider. My PCP, her name is Dr. Marcy Turner. I love her dearly, and she's pretty laid back until it's time to get aggressive. When she gets aggressive, it's like pit bull. And I love that about her. And so when it's time to make a move, we'll make a move. But if I have to cross that bridge, I'm blessed with a beautiful village of family and friends and a great provider and an amazing father, or a heavenly father that will guide me.
Yeah, and you said you're a believer, and I tell this story jokingly, but I believe it wholeheartedly. I actually met Chandlin. The funniest way I met her, the first time I ever met her,
Literally,
she was getting baptized.
you met me at my
She was
baptism.
literally coming out the water. She had a towel around her, and that's when we met. We were, around mutual friends for a community. We were actually all came to support her, and I was one of the new supporters, and I hadn't met her yet. And I got invited to her church, and that's when I met her, when she got baptized. So I always say, I know the new Chandlin, I don't know the old one. So I don't know the people that they know. I know the fresh water Chandlin. Amen.
Amen.
Okay.
Thanks.
So I'm privileged to know
The newer version,
yeah,
new and improved.
the one that got sprinkled. So my second question is, if you could change one thing in this world, what would it be? If you had the power to do it.
Ooh. And it's free too. Compassion. We do not consider each other. And this is a short story. I'm trying to keep it short as I can. I was literally in a bar and lounge not too far from here. And I was with my friend girl after a concert. And I looked at the other end of the bar, and there was a girl that just had her head down on the bar. And I'm like, and it wasn't super crowded in the place, but it was enough people where people should have noticed her. And so I'm looking, so I got up finally and I walked over to her and I was just like, hey, are you okay? And she's like, yeah, just a little lit, and had too much to drink. I said, do you need something to eat? She said, I actually just placed an order. I said, well, sit here and eat it. Don't take your food to go, because it looked like she was ordering her food to go. And she said, yeah, I'm going to sit here and eat it. And so I said, do you need me to call you an Uber? She said, no, I drove here. I said, I'm sure. But I said, I will call you an Uber and you can have somebody get your car later, but let me make sure you get home safe. And she's like, she looked at me and she's like, no, but I appreciate you even coming to check on me. And I think sometimes we just don't pay attention to people around us. We be in our phones, in our own world. We won't speak to people because we're too worried about how people are going to respond back to us. And I just think we need to pay attention to each other and show a little more compassion.
Yeah. Great story. I won't share the other story. But when I was drunk one night, but I won't share that stuff. she drove my car. But we'll save that for another episode. Sasha, what's your greatest fear?
So I would definitely have to say, just like you said, I because I am a believer, I don't really have a fear because I have faith. But what I would say is, because I am a mother of a daughter, I wouldn't want her to have to go through what I went through. Thankfully, the gene test said I didn't have any of the abnormal genes that could be passed down to her. But just like I was diagnosed without having any abnormal genes, doesn't mean that it couldn't happen to her or someone in my family. So my greatest fear would be something happening to her and her not remembering kind of what I was going through and like seeing about herself. Because I've been around too many family members who have waited to the end when they were having some issues, and then it ended up resulting in death. So I would want my daughter to live as long as possible. And then, of course, I have a son who is older than her. I would want them to be very, very close. Like, even if down the line I live to be, 85, 95, 100 years old. Like, I would
At the gym.
Yeah,
Sharp.
in the gym.
Go ahead.
We'd be like, man, that old lady, she got muscles. But I would definitely want her to be healthy and to pay attention to herself.
Good. I like that. What's the one thing you could change, if you could?
Ooh, if I could change something, I would say this. I would change the way caregivers are viewed. I don't think that people give enough credit to the caregivers. I had a lot of support both times when I was, going through my fight. And it was my family members, my mom, people making sure that I was okay, taking time away from work, taking time away from all of the personal things that they had going on to make sure that I was okay. And so I think that the caregivers do not get recognized as they should. So, maybe having something more for them to be able to help, the patients that are going through. Because sometimes they may not understand, what one is going through, or if I don't want to be bothered today, or if I'm a little grumpy because, some medicine has me, not feeling well. Someone to be able to just kind of just understand them.
Good answer.
Yeah.
Chandler, Sasha, this was an amazing show because of the information, the education portion of it, and your testimony. I want to thank you for being here. So, in summary, I always like to close with a little nugget, if I could. And this portion is called Don't Make Me Preach. So what I would like to say, my main key takeaway from this show is purpose. Because I see a lot of it in this room. I see a lot of purpose. I see a lot of people intentionally that's supposed to be here on this earth. And that's why they still here, regardless of their circumstances, regardless of any kind of health ailments. They're supposed to be here. Paul said once, I come to you not by wise words, but I come to you by demonstration. And I want to say Sasha came here today demonstrating loyalty, demonstrating friendship, demonstrating strength, educating us. So I believe you are here by demonstration, not only on this podcast, but I think you're here by demonstration on earth, because you are demonstrating a spiritual strength that has nothing to do with the gym. That has nothing to do with how many weights you can lift, or how many crunches you can do. This type of strength you can't even define. And I think you're here by demonstration. And I also think both of you serve a purpose. And I want to make sure you live through that purpose. Please do not misguide or take your gifts for granted. I think it's very important that you understand what your vision is and you chase that vision. I had a mentor who was a bishop of mine growing up, back when I was in church, and he told us, and I'll never forget it. He said, even a blind man can have a vision. He doesn't have to see to know what he wants. So that's what I would take away, and I could pass on to you. I believe there's foundations that you can start with what you're going through, whether there's grief counseling, whether there's survival advocacy of some kind. But I think there's something inside of you, in the pit of your stomach, that needs to come out. And I think that's going to be a part of your grieving process. I think helping others is how you grieve, because you are your most happiest when you're doing something as a servant. We all grieve in different ways. And I think your healing process is helping other people. And that's why we're here. If you read Matthew 25, that's what we're supposed to be doing. My name is Devin Banks. Don't make me preach. Grown Man Talking. Thank you. That was heavy. That was heavy. That was heavy.